The World Health Organization has declared the risk of Ebola virus high in Central Africa. However, the UN Health Agency has said that the risk still remains low across the globe, even as a latest surge in Ebola-linked cases has been declared an international health emergency. The WHO has added that the virus had likely been spreading for months.
After declaring the FIC, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as the high at the national and regional levels and low at the global level.
The outbreak of the highly contagious hemorrhagic fever was declared in Eastern Democratic Republic of Congo last Friday. Ebola has so far killed more than 15,000 people in Africa, in fact, in the past half-century. The 17th Ebola outbreak to hit the DRC is already suspected of having caused 139 deaths from around 600 probable cases. Experts say that the numbers are likely to rise further. In fact, the WHO has highlighted the complexity of detecting and responding to the current outbreak, which has been spreading in hard-to-reach areas of the DRC's conflict-torn Ituri province. Complicating things further, the rare Bundi Bugyor strain behind the outbreak does not show up on tests or the more common strain of Ebola, and with no vaccines or even specific treatment available for Bundi Bugyo, measures to curb its spread are still limited. The WHO has said that it's still examining whether any candidate vaccines or even treatments could potentially be used to rein in the outbreak. WHO's Emergency Alert and Response Director has stressed that all contacts of Ebola cases should be monitored on a daily basis and should not travel nationally or internationally for 21 days after exposure. Washington said that it is screening air passengers from outbreak-hit areas and temporarily suspending visa services, although a State Department official said that the DRC football team would be allowed to travel to the US for the World Cup. However, the DR Congo national football team on Wednesday even cancelled a planned pre-World Cup training camp at home after the country was hit by the Ebola outbreak. Meanwhile, Bahrain has announced a 30-day ban on visitors from the Democratic Republic of Congo, South Sudan and Uganda. And getting us more details on the Ebola outbreak in the region is our correspondent Louisa Olani, who sent us this report from Lagos.
Fear grows bigger as WHO says it may take about 9 months for vaccine to be ready. Goma has now tightened health checks on its northern borders after confirming a case there, while nearby Bukavu is bracing for possible spread. In Kinshasa, authorities have cancelled the national football team's World Cup training camp over safety fears. Many countries are taking measures to prevent it spreading as death numbers are expected to rise. From Lagos, Nigeria, Louisa Olani, WION, World is One.